Good afternoon. My name is Nidhi Madan. I'm a second-year cardiology fellow at Rush University Medical Center in Chicago. Today, I have the honor of interviewing and talking to Dr. Suhny Abbara. He's our president of the FSCCT, and here we are at the FSCCT 2018 talking to him. Dr. Abbara is the head of the division of the cardiothoracic imaging at the University of Texas Southwestern. And thank you, Dr. Abbara, for taking the time to talk to us today. It's our honor.
Thank you.
So as a member of the first committee, I have a couple of questions that I think our audience would be interested in knowing from you. I would like to start by asking, as the president of the FSCCT, what do you think, with all these advancements in the technology of cardiac CT, where is the field of cardiac CT heading?
Oh, great question. So, predict the future. Well, we're right now here in Dallas at a beautiful resort, and we've already seen a lot of evidence being published and a lot of new things. We've seen more information about morphology and the strengths of coronary CTA, about some function, ventricular function, valve function. We've seen CT physiology for coronary lesion, to do CT FFR using computational fluid dynamics, and now also machine learning, and some evidence that's shown that they get comparable results. We have seen that we used to say, well, cardiac CT doesn't give you physiology or flow, but there's evidence now that you can use calculations to get 4D flow information from CT. So we can now measure the flow. This is early evidence, of course, but it's been shown that you can measure the flow through the mitral valve and through the aortic valve, for example. So, wow, this is so much more than during the first SCCT, where it was mostly about morphology. So we have a full complement of pieces of information that we're getting. Machine learning, taking cardiac CT information, is just one out of many parameters into account when predicting events is there. We have seen new journals come out, a dedicated journal to AI, a dedicated journal from the radiology group for cardiothoracic imaging, a dedicated journal for 3D printing. And of course, JCCT had a total overhaul. So where are we going? I think we're not going in one direction. We will be going in many directions. So CT is supposed to really become that one-stop shop where we get a wealth of information. Now we have to learn through trials to know to use that information to best improve patient outcomes. So we will be seeing a lot of trials looking at the combination of, plaque characteristics, stenosis grading, and physiologic information as composites. So a lot of directions, and not just one direction, is what my prediction is for cardiac CT.
That is very exciting that we're seeing all these expanding indications and the use of cardiac CT, particularly now in structural heart disease, procedure planning, beyond anatomical assessment of the heart. Now, like you said, that we're looking at physiological parameters to see how CT can be useful in all these areas.
Right.
And as we're talking about that, which of these indications excites you the most as one of the indications that you can point out? I know it's tough because we have so many here, like we talked about. Maybe you could give us one indication that is the most exciting for you.
So I'm going to pick an underdog here. There are many things we're doing, as I mentioned, and most important, of course, is atherosclerotic imaging and managing patients, avoiding perhaps future adverse events. But I was really intrigued by 4D flow cardiac CT because it's just a new technology, very early in its development. And another thing I was very intrigued is congenital heart disease imaging Kelly Hahn gave a wonderful presentation, receiving the DeHaan Award for the first year here at FSCCT this year. And she showed that they have recently created a network of sites entering into a multi-center trial showing the benefit of CT in the congenital heart disease population. As you know, we've gotten better in treating patients, so the ratio of pediatric and adult patients with congenital heart disease is shifting towards more adult, which is a sign of success. We have no good information, and this trial will create some good information that's barely needed. So I'm very excited about that.
That is interesting to know. One more question that I have, and I've been thinking about it, looking at all these indications and all the growth in the modality of CT. What would you say are two limitations for the use of CT in clinical practice?
So perhaps the biggest limitation in the United States is adaptation, which perhaps in part or in no small part is due to reimbursement. Perhaps it's due to education of our referring physicians, and I'm very careful in how I phrase it, referring providers, perhaps because the providers that are users of CT information are a huge group of physicians that includes ED physicians, as we've seen in the great debate that Dirks from UT Southwestern, who's heading the largest ED department in the country, is one of those users, not a cardiologist, an ED physician, with primary care physicians that become users. There may be some old referral patterns that are the way they are because of and not met opportunity in education. Here at FSCCT, we do talk a lot we're preaching to the choir. So we talk to people that are already hooked, that have already seen the evidence for cardiac CT. Of course, reimbursement is a big issue. We do have level 1 evidence for cardiac CT in many scenarios, thanks to all the investigators that really make up this group, the members of FSCCT.
Yeah, that's true. Thank you for that. Going forward, as the president of the FSCCT and as an expert in this area, what would be your advice for our fellows and trainees and young career members, early career members who are aspiring to be cardiac imagers and in this field of cardiac imaging?
Follow your passion, number one. If you like what you're doing, you will be doing it a lot and you'll be good at that. It's important that you have a passion for what you're doing.
Right.
The other thing is follow opportunities. If I'm thinking about the great leaders that FSCCT had, our past president, the president before that, we have Todd Reliance, Leslie Shaw, Jonathan Leipzig, Ricardo Curry, and many, many more. And I skipped a little bit here. They all have really one thing in common. In addition to following opportunity and their passion, they're really hard workers. If you want to come to work at 9 and you need to leave at 5, it is very difficult to be very successful. So follow your passion, follow opportunities, work hard. And lastly, do what's right and not what's easy. And that is true for your clinical activity, and that is true for research. You sometimes have to go the extra mile because it is the right thing to do, even if nobody is looking and recognizing it.
That is a great advice, and I thank you for that. I think we all look up to you as one of our leaders in the field and an expert. And I think it's very important for us trainees and fellows to learn all these different qualities that we need to have to grow in the future.
Right, thank you.
Thank you so much, Dr. Abbara. It was great to have you today.
Thank you, my pleasure.